All right, question number one. Is it okay I'm asking you this? Absolutely. I used to be a biology teacher. I love explaining this stuff. Seriously though, my StrengthsFinders profile includes learner. I really enjoy learning about this stuff and I'm pretty good at it. I also used to be a biology teacher, so I know how to explain some of these things in ways that people can understand without politicizing them or making them about anyone's elections. Question number two. Why don't we just open things up and try for herd immunity? That is a great question. So the goal is herd immunity, but how we get there is kind of the tricky part. We can get to herd immunity by reaching 60 to 70% of the global population, not just any community's population, but the global population, having contracted the virus somehow. Either the live, actual virus that makes you sick, or a vaccine that is built from the virus. So let's map a scenario where we don't mitigate at all and just try for herd immunity. The world has about 7 billion people in it. If we're going to reach herd immunity, we need 60 to 70% of the population to have contracted the virus. So let's go on the low end of that, just to be conservative. 60% of 7 billion people equals 4.2 billion people. That is 4,200,000,000 people sick. Now, some will be asymptomatic, so we'll call it sick. Some will be sick, and some will go to the hospital. The exact percentages of those we don't know. But let's experiment with one number. Some of the data has suggested the mortality rate could be as high as 5%. Some of the data has suggested that the mortality rate could be as low as 0.5%. So let's just go on the low end of things and say 1%, a 1% kill rate. So that would be 4.2 billion people times 0.01 to get us 1%. And that gives us a mortality rate of 42 million people. Now there was that video that circulated on YouTube for a minute where that reporter's mic was on and he didn't know, and he cited a study that said maybe the numbers in California suggested something like a 0.5% mortality rate. But even still, that would give us 21 million people dead inside 2 years. Maybe even inside one. This is what happens when we just gun straight for herd immunity without any kind of mitigation. Now these numbers are big. Sometimes they're hard to work with because they're just so large. So let's play the game again, this time with just the American population. Let's say the United States has 350 million people. So 60% of 350 million equals 210 million people. Again, sick in some way. Now, before you balk at that and say, well, a lot of the sick don't actually get sick, they can still go to work. About 75% of the people who get sick, some kind of sick, like stay home from work sick. And remember that even if you aren't sick but you're testing positive, you're gonna get quarantined. So this is 210 million, possibly in some way removed from the workforce. That's a lot of people. Now if we multiply that by 1%, we get 2.1 million Americans dead inside, again, 2 years. This is just conservative math. Now here's the kicker. Let's say 5% of these people need to be hospitalized. So that's 210 million times 5%. Gives us 10.5 million people who need the hospital at roughly the same time. Now, even if they don't all go to the hospital at the same time, what you're still talking about is 5 million people in the hospital. Even if it accidentally meters itself out evenly across 2 years, you're still going to end up with 500,000 people in the hospital at one time. The American medical system cannot tolerate that load. And what that means is that this number then changes. The people who die because the hospitals are full multiply this number considerably. All right, so you can see the game then isn't about avoiding getting sick versus avoiding losing your job. The game is kind of about the balance between compromising a community's healthcare system versus compromising a community's economic engine. That's the thing everyone's trying to avoid. Everyone's trying to avoid both of those things. And we might not be able to avoid either of them all the way at all. That is so hard for Americans to hear, that we might be in a no-win situation. Something an African doctor said a month ago that didn't get enough press, I think. He said, "We are not safe anywhere unless we are all safe everywhere." I think that's worth considering. Once borders open up and flights resume, if airlines survive this, we're going to have the threat of constant reinfection from other places. And when a particular community's healthcare system gets compromised, people begin to die of things other than COVID that they wouldn't have died of if that particular community's healthcare system had not been compromised. Now, here's something to think about. A month ago on the news, again, not a lot of press, a Chinese national was stopped entering, I think it was Detroit, with a suitcase that had live virus samples of SARS and MERS and something else. Imagine how much devastation could be wrought in a country whose healthcare system had already been pushed to the brink, whose supplies had been used up, whose medicines had been consumed, and whose doctors and nurses were sick or unavailable. Imagine that community being on the receiving end of a bioterrorism attack. Nobody wants a scenario where the healthcare system collapses. I also read recently that in Detroit, a large percentage of the police department has contracted the illness and is sick at home, some of them in the hospital. They're not even pursuing some crimes because they're unable to police the serious crimes with the staff that they've got. Think about how much business you could do if misdemeanors were never, ever policed. There is no world in which it's healthcare versus economy. It's healthcare and economy are both badly threatened. Gunning for herd immunity is what we're doing. I think, though, that everyone's trying to make sure that we don't have an economic collapse or a healthcare collapse on the way there, because either one of those will lead inexorably to the other. Question 3, what is up with testing? Okay, so testing works like this. There are basically two different tests. One tests for the presence of coronavirus in your body, and the other tests for the presence of antibodies to the coronavirus in your body. When we're testing for coronavirus in your body, we are looking for little pieces of genetic material from the virus, right? And that's why they stick that swab up in your nose and try to find it. It likes to replicate in your nasopharynx and your upper respiratory tract, and then make its way down into your lungs where it likes to live and kill you. The antibody test falls into two categories. There is the fast antibody test, the fast response one, rapid response, and then there is the ELISA test, that takes longer, is more complicated. The first, the rapid antibody test, tests for the presence of antibodies. Do you have any antibodies at all to the coronavirus? It does not tell you how much immunity you have, though. It just tells you that you had the coronavirus before. The other one, the ELISA test, that tells you how many antibodies you have inside your body. And even that doesn't tell you if you can't get sick again. Some of the ELISA tests seem to work better the closer you are to having been sick. You get further out and it's harder to tell how much immunity you actually have. It's actually very hard to tell how much immunity you have because the presence of antibodies is not necessarily proof positive that you won't get sick again. There's two problems with the test right now. One is they're astoundingly unreliable. Lots of false positives and false negatives, lots of false. Way too much to be statistically reliable, almost invalid, nearly useless. The other problem is that we can't make them. It doesn't matter how many times news pundits get on TV and say, where are the tests? Why don't we have tests? We can't make tests because we don't have the reagents to make the tests. Tests are made out of stuff, and we don't have the stuff to make the tests much faster than they're being made. There's, however, one possible use for the test. You could do a structured sampling where across different socioeconomic demographics and different geographies within a large population, so like within the United States or here in Spain, they're going to do this kind of testing. A very large number of people across all different demographics and all over the country in order to identify basically where has this virus been and where has this virus not really been much yet, to identify where are places that are likely under more risk. This kind of testing can be done immediately in the United States. It can be done immediately anywhere. It's really helpful for learning. It is not useful to drive policy. Question number 4, what should I do? Right? I would do some things. I would abandon oversimplification. Everybody on TV in America appears to be really committed to getting you to believe one narrative or another. And it's basically, how can we use coronavirus to drive outcomes for an election that we have coming up, one way or the other? Super stupid, irresponsible, childish, and we buy it. We buy it hook, line, and sinker because we want a simple story, because the complicated story is scary. The simple story is scary, but a complicated one is scarier because we can't understand it. It makes us feel like children, and that makes us feel even more powerless. So we will ally ourselves with a really stupid, oversimplified story simply because it makes us not feel as stupid. I would avoid that. On the other hand, I would avoid paralysis. I've had a handful of friends the last week tell me, well, it's hard to know what to believe because everybody spins everything. I guess we can't really know anything. Yeah, you can. You can know stuff. You can get numbers and do basic arithmetic. You can do math and you can know things. You can know things. And there are some things that we don't know and some things that we absolutely know. And there are a lot of things that we can be about 70% sure of, and we can take action on those things responsibly, even if we're not 100% sure. You just need to know about 70% sure something before you can responsibly act. Once you have 70% of the relevant data about something, the likelihood that the last 30% is going to be different than the first 70 is infinitesimally small. The third thing I would do is I'd protect the asset. The asset is your body. Anything that you can do to make your body more anti-fragile is a good idea. Not because we are afraid of dying. I follow Jesus. I believe in the resurrection. I'm not super afraid of death. However, if the human race wants to do well against this thing, then the human beings inside the human race need to do well against this thing. And anything one human being does to increase their anti-fragility, to make themselves more resilient, makes the species, in this case, more resilient. In the description below, I'll put a link to some other videos on how to thrive in different dimensions of your personality, spiritually, emotionally, cognitively, physically, relationally. These are all probably getting hot right now if you've been in lockdown very long. Some of them are starting to go numb, some are starting to get crazy, some are getting a little angry. The one that I think undergirds all the others, and you might be surprised to hear this, is the physical one. I think that your body is very important right now. I think the most spiritual thing you can do is probably eat well, sleep, and exercise. I know some people will be surprised to hear me say that. I am a spiritual director. I've been helping people follow Jesus for a long time. I take my relationship with Jesus very seriously, and I know that when I sit down to read my Bible and my head can't get clear, and if I attempt to pray and my internal noise is just too crazy, I know that when I am working out, I bring a much more centered person to those disciplines than when I am not. My cognitive health, my emotional health, my spiritual health, my relational health, everything improves when I take care of the asset. The fourth thing I would do is prepare for the long game. This is not going to be over soon. Pieces of it will be over. Maybe the piece that you're in will be over, and it may come back and it might come back differently, but this whole thing, this chapter of the human story is not going to be over right away. We're probably a couple of years before this is in the rearview mirror. You can feel already probably how long 4 weeks can feel in uncertainty and fear. You are going to need to be pretty resilient to do 2 years of whatever it is. And I know the idea of being in lockdown for 2 years is a horrible thought, and no one's going to be in lockdown for 2 years. No one can. No country can do that. No country should do that. However, you're going to be disempowered by this for 2 years. It's going to take choices away from you for 2 years. And you're not always going to know what's going to happen next for 2 years. And sometimes terrible things are going to happen for 2 years. In order to make it, you're going to have to pace yourself. So I would really encourage you to spend less and to slow down. The pace that you live in quarantine in, how much expectation you place on the next get out of jail date. Your Q naught is as important as the R naught at this point if you want to come out of this hole. All right, number 5, I would not expect to come out of this hole. You might come out of this hole. I might come out of this hole. People who pay attention to some important wisdom will come out of this hole. But the human race, all countries, all economies, all governments, all peoples, are taking a very significant blow from this right now. And anytime we look at a leader and we expect them to get us through it without massive economic fallout and without massive loss of life, we are being childish. Stop it. We're not getting out of this completely whole. All right, so that was your COVID Q&A for this week. Feel free to send more questions. Again, I am not an epidemiologist, though I have been a biologist and a biology teacher. I'm very happy to answer questions and to be of help if I can.